Hi everybody, welcome back to my channel, or welcome if you're new here. My name is Katie. I am 48 years old and I am documenting the weight loss journey that I'm on currently and talking a lot about my whole experience with obesity through the years. So today is just really a kind of a quick update for you. I'm a little bit low energy, feeling kind of blah today. I had some caffeine yesterday later in the afternoon than I normally do, and I had a hard time falling to sleep last night. So today is just kind of like a low energy, blah kind of a day for me. But I did have my weigh in today, and so I wanted to hop on and do a quick update for you. So this week was week 36. Last week I weighed in at 187. And today, this morning, I weighed in at 183.2, which is a pretty big loss of 3.8 pounds this week. Now, I think some of that is kind of catching up. I had two relatively slow weeks compared to what I've been having, 0.8 2 weeks ago and then 1.8 I think last week. So this is definitely a bigger loss than you would normally expect to have, but I think it had to do with that. I told you guys I was going to do an experiment and try to get out for sunrise more often. I hadn't been able to do that because of the timing of it. And if I'm honest, I really wasn't able to do it as much as I had wanted to. I did get more than I normally do in a week because Monday was a holiday for me, and so I was able to spend a good 20 minutes outside at sunrise on Monday this week, and then yesterday and today I did the same as well. So maybe I wasn't that consistent Tuesday through Friday with getting the sunrise light that I had wanted, but I don't know, maybe it made a difference being able to get more when I did it 3 days per week instead of just 2. So that might have been it, why I had a bigger loss this week. I did also try something new. I've talked a little bit about in other videos. I don't know if you've seen them yet or not, but I've talked a little bit about in other videos that I think that I have something called lipedema. And part of that condition is that lymphatic fluid gets trapped in your tissues, especially in your legs, and it just can't get out of there. So I did buy a pair of like medical grade compression leggings, and I've been trying to wear them every day. They are not super comfortable. It's hard to go to the bathroom. I go to the bathroom all the time. I'm always drinking water. I'm always peeing. It's kind of a pain in the butt. But I have been looking into it more, and I think that it's a kind of a critical component to trying to treat it or heal it, because if you don't have compression on the area, then the fluid just pools and it just stays in there and it can't get out, and the more it pools in there, the more pressure it puts on those tissues and the more damage that it can cause and create over time. So if you want to try to heal it, you really need to be using compression garments to encourage the fluid to come out of the area and reduce the pressure. So it's possible that the compression leggings helped move some of that lymphatic fluid out of my legs. And I may have just peed that out throughout the course of the week. So that could also be a part of the water weight loss this week. I'm sure it was probably not 4 pounds of fat. So there was probably some water loss in there as well. So that could have done it. I'm going to still continue to use them. Like I said, they're not super comfortable, but if they can help me have any relief from the lymphatic fluid and the pressure and all that stuff in my legs, and help with the healing process with that, then I think that would be worthwhile. So moving forward for this coming week, I don't think I'm going to really be able to do much with the sunrise during the weekdays. It's just right in the wrong time. Maybe if it gets, if it keeps getting later in the morning, I might be able to get to work, 5 minutes earlier, and then, at work do it like I had kind of wanted to do now, but it's just too early for me to get there that early. So as time goes by, that might improve, but I think we'll just try to make the most of it on the weekends when I'm at home, getting, 20 minutes if I can in the morning of that sunrise light, continuing on with that, because I do think that that's important for for leptin and the circadian rhythm and all of that stuff. That has made a big difference for me. So I'm still on 7.5 milligrams. I definitely don't have any intention of moving up at all. I've kind of been toying with the idea of actually backing down a little bit. The appetite suppression that I have is pretty strong, and maybe it's a little too strong. I mean, I don't want to slow my weight loss down, but I also don't want to get my body into a state of where it's unhappy or panic or anything like that. And, I've been super happy to lose 3 pounds per week. All the last few months, it's been really great, but I am starting to notice a little bit more hair fall in the past week. Not ideal. So I don't know. I'm kind of toying with the idea of possibly not going all the way down to 5, but possibly just kind of somewhere in between. I do use the vials, and so I can, draw up however much medicine out of them that I want. And so I could potentially kind of go somewhere in between 7.5 and 5 and see, if I can have it so that I'm still losing consistently, but my appetite suppression isn't so crazy. I'm toying with the idea. I haven't decided for sure if I'm going to do that. It's a hard decision to make. I mean, I'm getting close to one of my first goals, and that's going to be around 170. In the back of my mind, or we've talked about before, my ultimate goal would be 150. That's where I was back in my 20s when I had lost weight the first time, and I did really like it. I'm starting to wonder if, what might be a better approach for me at this age is to start a little bit, not maintenance, but kind of like working my way towards maintenance. So doing kind of a slow reverse diet once I hit 170, and do more of a body recomposition than, just straight out trying to get all the way down to 150 right out of the gate without caring about, muscle and all that kind of stuff. I was looking through old pictures this past week, and I was really seeing like, I have some from when I was 170, and although I did have the lipedema look of the legs, overall I was working out a lot, and you could tell, I had muscle definition, and I looked relatively healthy. And if I could eliminate the lipedema, I would have been happy with my body at that weight. And I think that was around 170. And I'm not saying that I'm tied to that number, but I'm starting to kind of rethink it a little bit, in that, the healthiest approach might be for me to start with a more modest goal, and then kind of as things are going over time, I can work on more body recomposition, so I can add more muscle mass, and I can still decrease some of the fat, and I'm going to be working on lipedema tissue and trying to smooth that out as much as I can. So I don't know, I'm tossing some things out in the air. I haven't really landed on any firm decisions yet on any of this stuff. I'm super, super happy with my progress. I mean, down 90 pounds is amazing. There was a time that I never ever thought that I would be here again, and I'm absolutely blown away, so grateful that I've had access to this medication and that it's worked so super well for me. And I'm just over the moon. I'm so ecstatic with my progress, and the future is exciting. I can't wait. So right now I am about 13 pounds away then from that first goal, and I haven't decided yet this week what I'm going to do. I will probably just stick with 7.5 milligrams for now, but I'm still toying with the idea. We're going to see. My shot day is supposed to be Tuesday, so we'll see how I feel come Tuesday, if my appetite has come back and things like that. But again, the appetite suppression has been pretty strong, and I think that it may not need to be that strong. I have added some supplements that I wish I had brought in here with me, but they seem to kind of boost the appetite suppression of the medication itself. So if I weren't taking the supplements that I'm taking, you know, the appetite suppression would usually be, you know, like it would start maybe 24 hours after the shot and go for a couple, 2-3 days, and then it would start to kind of gradually wear off. So by the time, you know, day 5, 6, and 7 would roll around, my appetite would be pretty normal. And since I added these 2 supplements in, it seems to accentuate the appetite suppression. So, you know, the medication is doing its part, and then these supplements are doing some more. And I don't want to stop taking the supplements because they, I think, are doing some stuff behind the scenes that is important for healing and mitochondrial health, which is something that I'm very interested in. So I don't want to stop taking those, but if it's kind of pushing this dose to a level where the appetite suppression is more than I really need for healthy weight loss, then, you know, it might make sense to back down on the medication a little bit and see how that goes. But it's just such a scary prospect. If you've ever been in the position where you're obese and you're trying so hard to lose weight and you can't lose weight, and you know, now finally having success at it and then thinking about messing with that, it's kind of hard to consider that. And then you see so many people struggling with it, and, you know, hypo responders, and, you know, people who are really just turtling along and really trying to scrape along, you know, a pound here and a pound there. And, you know, I feel blessed that that is not my situation. But I certainly don't want to go to an unhealthy place, and I don't want to keep pushing it too hard or too fast. You know, that's obviously, they don't recommend it, and I'm sure that they have good reasons for it. So it's hard to let go of the fast pace of weight loss, especially when I'm so close to my goal, or at least one of my goals. So that's something that I'm going to have to wrestle with a little bit here. I'm going to do a separate video later this week about those supplements in case anybody is interested. You know, they're certainly not mainstream, and, you know, and again, but one thing that I've noticed is it does seem to have increased the amount of appetite suppression that I get from the medicine. And now some people don't need that. I mean, some people are on 2.5 milligrams and they have plenty of appetite suppression. They can't eat anything. Obviously, you know, they're not going to want to add something like this, but this might be valuable to somebody who might be, you know, not everybody gets the food noise reduction and the appetite suppression from these medications. You know, not everybody does. And so that can certainly affect your progress sometimes, or how difficult the weight loss can be. So I'll share it with you in case you're interested. So I'll probably do a video on that. Maybe I'll just do a whole one on all of the things that I do. So all of the supplements, and, you know, my routines, and electrolytes, and all the kind of stuff that I do. So I'll do a separate video on that later, and you can find more details about that. But I thought it maybe would be good to share that with you. So this has really just been a very brief update. Like I said, I'm tired. I'm kind of feeling blah today. So I don't have that much more to share, but I wanted to keep you posted. So there we go. Week 36, down 3.8 pounds for a total of 90 pounds lost. Yay! All right, I'll talk back with you guys later. Have a good one.